In patients that have severe aging, including a significant amount of mid-face aging, as well as severe aging along the jawline and neck, the RT mini lift just is not going to work. You really need to divide that entire zygomatic ligament in order to be able to rejuvenate the face. Any other type of procedure is going to give you a suboptimal result, and you're not going to get the amount of lift that you really need to rejuvenate the face. This is basically a deep plane facelift. So going back to the anatomy discussion, so underneath the skin is the muscle layer. So the muscle layer is cut, and all of those retaining ligaments, the zygomatic, masseteric, mandibulocutaneous, as well as the platysmo-sternocleidomastoid ligament, are all divided to get the maximum amount of lift. Because now, once you've divided all those ligaments, that muscle can go in any which way direction you need it to go. There's nothing holding it back, so therefore you can really lift all the tissues that have fallen, and there's almost no tension on the skin. Main advantages with the deep plane facelift are the fact that longevity is the best, the amount of pull is the best. Now, it goes with a few risks as well. If you remember our prior discussion on anatomy, underneath that muscle layer are where all the important structures such as nerves and such exist. So that is a definitive risk to this type of facelift. Literature studies have shown that the risk by an experienced surgeon, that's the most important point here, is the same doing a deep plane facelift versus doing a simple SMAS or mini lift type procedure. So the main take home point is experienced surgeons who have plenty of experience dealing with deep plane facelifts, facial anatomy, so on and so forth, the risk profile is going to be exactly the same. So that is an important take home point, but I think I really need to drive that point home in the purpose of this video, because that's the main important risk when you're lifting the deep plane.